For this first segment, just an indication of the orientation. So the head, the cranial, will be to the left. The tail, the caudal direction will be to the right. All we're going to look at here is a pretty good example of one of those cutaneous or dermal muscles, and specifically this is the cutaneous trunci or the cutaneous maximus. In this animal, most of the muscle's intact, so it's a good one to look at. Let's flip it on its side. See the muscle, it's definitely superficial to the superficial fascia, and of course it's on its way to inserting into the skin. All right, so we follow the muscle around the side here and into the axilla, and it's chewed up a little bit from when they took the pelt off, but we can definitely see it, attaching to the superficial surface of the pectoralis minor. It also would have been attaching to the superficial surface of the latissimus dorsi, but the latissimus dorsi has been hacked out in this region, so we can't see that very well. Okay, so in this segment, we're just zeroing in the axilla of the animal so we can see the attachment of the cutaneous trunci in a little bit more detail. And once again, here's the pectoralis minor clearly attaching to the superficial surface of that. And then, once again, here's the latissimus dorsi should have been filling this area right here, and it would have also attached to the superficial surface of the latissimus dorsi. Okay, this is another animal that we'll just briefly look at because it shows the extent of the cutaneous trunci muscle, probably what most of you will see in your animals. Most of it's been removed when they pelted the animal. To my left here is the head once again, and in this animal, the only part of the cutaneous trunci muscles that remain are these little patches right here. Once again, you can see it's superficial to the superficial fascia. It's on its way to inserting onto the skin. In this animal, I'm going to demonstrate how to begin dissecting this ventral surface of the neck, chin, and the ventral surface of the neck here. And on all your animals, you'll notice these two strings sticking out of a random slit in the muscles. And these strings are just where, when they were preparing the animals, they injected the arteries with red latex and the veins with blue latex. So they're just getting in the way. We don't need them anymore. Snip them. All right, so as I indicated in the PowerPoint a little earlier, this area of the jaw is covered by a very strong, very dense, deep fascia. So I'll show you how to remove that, and so we'll get on with the dissection. So all I'm doing here is I'm just using my scissors to get underneath the deep fascia, maybe pull it up with a forceps, make a little slit in it. Okay, just look underneath to make sure we're not cutting any muscles, and I'm not. So we use the blunt probe to define the fascial plane between the deep fascia and the superficial muscles in this region. Okay, so the plane's defined. Now it's safe to go back with the scissors, insert the scissors, lift up on the point, and cut. And just continue that all the way up to the chin. All right. Let's go back to the left side of the animal, and you can see that the deep fascia is still firmly attached to the digastric muscle, which is right here. In this animal, the deep fascia is attached especially tightly to the digastric, so I'm going to separate it with the needle probe. This tends to break the fibers better than the blunt probe does. So once again, pull on the deep fascia, sweep in the area between the fascia and the muscles, this case with the needle probe. All right, so now the deep fascia is pretty much out of the field of the dissection, so we can just cut it and get rid of it. We switched to a larger animal here, so all the deep fascia has been removed, so we're looking down on the first layer of muscles. Here's the right digastric muscle. Over here is the left digastric muscle, not well cleaned out yet, but you can see it. And here, in between the two digastrics is the mylohyoid muscle. And this animal's already been dissected, so the muscle's chewed up a little bit, but I think you can clearly make it out and clearly see that its fascicles are running transversely as opposed to longitudinally. Okay, so so the mylohyoid, as the name indicates, inserts onto the hyoid bone, which is right back here, and so we snip the mylohyoid up the midline where the left one fuses with the right mylohyoid. We also cut the mylohyoid from its attachment to the hyoid bone, so we can now totally reflect the mylohyoid muscle. So there it is, it's out of the way. And now we can start to see the next layer of muscles. All right. And next layer of muscles, the first ones are these two small strap-like muscles, and these are the geniohyoid muscles. The left one, the right one. Genio originating from the chin and also inserting onto the hyoid bone, which is right here. Okay, then just lateral and deep to the geniohyoid, we'll work on the right side here. We'll have the genioglossus muscle, which is right here. All right, here's the genioglossus muscle. It also originates from the chin, but note that it does not insert onto the hyoid bone. Instead, its fibers turn dorsally, go towards the blue mat here, and enter the tongue and become, some of the muscles of the body of the tongue. All right, so we've cut the mylohyoid on both sides and reflected it, so it's lying attached to the digastrics. Now we can see the next layer of muscles, and the first two muscles the first pair of muscles we see are the geniohyoid muscles. There's the left one, there's the right one, and this space right here is the midline. And as the name indicates, they originate from the internal surface of the chin, and they insert onto the hyoid bone. And this right here, you can maybe see this white area. This is the hyoid bone right here. Okay, so here's our geniohyoid. All right, so then just deep to and a little bit lateral to the geniohyoid, we should come across the other genio muscle, and that'll be the genioglossus. And indeed, there it is. Okay, here's the genioglossus muscle. And once again, it's pretty clear it's originating from the internal surface of the chin, but it is not inserting onto the hyoid bone back here. Instead, its muscle fibers are turning dorsally and, of course, entering the body of the tongue. All right, so we have the geniohyoid, genioglossus. So let's come back to the hyoid bone here. And here's the geniohyoid attached to the hyoid bone. And just lateral to that, to the attachment of the geniohyoid, we have the attachment of another muscle right here. And this muscle will be our hyoglossus, going from the hyoid bone and once again entering the tongue. So that's the hyoglossus. All right. Okay, so the only other muscle we have to find here is the styloglossus. Clearly make out the styloglossus muscle close to its origin from the hyoid apparatus. And to do that, we have to dig deeply here, going dorsally towards the base of the skull. And that's what we've done here. And I'm sweeping my probe over the styloglossus close to its origin so we can definitely make it out. Okay, now as all these muscles, the styloglossus, the hyoglossus, the genioglossus, as they approach the tongue, All their muscle fibers interdigitate and intermingle with one another, so it's just a mass of muscle, making up, the body of the tongue. All right, another important thing to point out here is this landmark that I talked about earlier, and this white, very white, fairly stout structure is the hypoglossal nerve. And normally the hypoglossal, it serves as a good landmark because normally it separates the hyoglossus muscle from the genioglossus muscle. It dives down into that fascial plane. But this animal is a little different. Remember, we talked about variation amongst animals. And in this animal, the hypoglossal nerve actually goes through the hyoglossus muscle. So you can see that right here, the nerve clearly going right through the hyoglossus muscle. But once it passes through the hyoglossus muscle, it still dives down into the fascial plane. So on the lateral side, we have the hyoglossus. On the medial side, we have the genioglossus muscle.